It's the start of 2022, but what's going on with COVID in Wyandotte County? We're going to talk about that today, kind of a status update, and then what we can do going forward. It is January 6th, 2022. My name is Janelle Friesen. I'm the Public Information Officer with the UG Public Health Department, and we have Elizabeth back on here. Do you want to say hello?
Hello, my name is Elizabeth Groenweghe. I'm the Chief Epidemiologist for the Health Department.
Always good to have you back on here. And I'm interested to hear you give us a little bit of a status update and a data update on where we are with COVID-19 in Wyandotte County.
Yeah, Janelle. So unfortunately, the data is not looking good, and this does seem to be the worst COVID surge that we've had to deal with so far. Our numbers are up a lot from where they were before. We look at our 7-day rolling average a lot to get an idea of how many COVID cases we're getting. At the end of October, our 7-day rolling average was about 20 cases a day. It is now 306 cases a day, to give you an idea of just how much it's increased. Our percent positivity is also much higher than it's ever been at 62%. So really, we're just dealing with a lot of COVID, more than we've seen before in Wyandotte County. Yesterday, we had nearly 500 people diagnosed with COVID in Wyandotte County, and that's only including cases that are reported to us from hospitals, labs, clinics. That doesn't include the home tests. So we know that there's even more COVID cases out there than what we're aware of. The part that has us even more concerned, though, is our hospitalization numbers. We shared a video that was hosted by KU Hospital, as well as all the other hospitals in the region, where they had a press conference yesterday morning talking about how overwhelmed the hospitals are right now. And it's a really concerning situation. The hospitals have never seen COVID cases as high as they are now. They've got a lot of critically ill people in the hospitals, to the point where they're postponing elective procedures and surgeries, taking nurses from outpatient clinics to staff the hospitals and essential functions. It's just a really concerning situation.
It's tough to hear what's going on right now. And I listened into what the folks from the hospitals were saying yesterday, and it's not just affecting people who have COVID. If someone has a heart attack, if they're in, a car crash, whatever it may be, that affects being able to get care that you need at the hospital. Sorry, go ahead.
Oh, yeah, you're absolutely right about that. I think that's one of the most frightening things that we need to consider is when hospitals are this full with critically ill patients. You're right, it has an impact on other people that maybe have heart attacks, strokes, traumas, car accidents, really time critical things. And it's especially having an impact on some of our rural populations where they don't have access to critical services, trauma centers, things like that out in rural parts of Kansas. And so they typically rely on hospitals like KU to transfer those patients for the care that they need. And when KU's completely full with COVID patients, it puts everyone in jeopardy.
So we know how dire the situation is right now with things, with our cases so high and with our hospitals getting really overwhelmed. What can we do about that? How can we move forward and hopefully come out of this?
Yeah, that's a really good question. And unfortunately, the way things are trending right now with the data, things are going to continue to get worse before they get better. So we really need to take action now to try to do what we can to slow this rapidly rising surge. And so a lot of the things that I'm going to talk about are things that I've talked about before, that other public health people and medical professionals have been telling people to do this whole time. The most important thing is to get vaccinated. And we now know that that booster is so important as well, especially with the new variant Omicron quickly spreading here in Kansas City. Getting that booster as well is essential. We also know that right now we haven't had many of our children get vaccinated. You know, we now have vaccine for 5 to 11-year-olds, but only a small percentage, about 25% of our children are vaccinated against COVID. And with school back in session this week, we anticipate we're going to see an even larger surge in cases because of the spread going on in schools. So vaccination is still so important, as well as getting that booster dose if you're eligible for it. Wearing masks is really important as well. We strongly feel that even though there's not a mask mandate in Wyandotte County right now, wearing a mask in public is one of the best things that you can do to protect yourself and others. We also really feel that the kind of mask that you're wearing is going to be important. If you have access to a higher filtration mask, a higher quality mask, that's going to be better. And we're working on getting those out to the community as well. And then trying to avoid large gatherings. I know that we're all really tired. We're really fatigued at social distancing and just COVID in general, but as much as you can avoid large gatherings right now until we're past this surge, that's going to help contain the spread as well.
Okay, thank you for that. It's always good to get those reminders, and yeah, getting that vaccine and that booster, as well as the masks and avoiding gatherings, you know, all those things combined. It's not just one or another. Doing those together is what's really going to help us, you know, get through this surge. I want to wrap us up by just talking about where people can find vaccines and boosters, where they can find testing. We know there's really high demand for testing right now. We're going to put links in the description of this video to where people can find testing locations and vaccine locations that are near them. We do still, the health department does still provide testing and vaccinations at the Kmart site, and we also still have vaccine appointments at our health department building in downtown KCK. We have had some changes to those hours, but again, those will be in the links that we share. But there are a lot of other places where you can access those things right now. And we just ask that people look at what they can do in their own lives to help us through this. Thanks again, Elizabeth.
Yeah, thank you, Janelle.